Welcome back to our channel. In this video, I will talk about partial knee replacement. In very general terms, a knee replacement can be described as an artificial device that can replace, either totally or partially, a worn-out joint that is causing pain. In this image on the left, you can see an X-ray of a healthy knee in which the joint part of the femur in red is well spaced from the joint part of the tibia in yellow. The apparently empty black space you see on the X-ray is actually filled with cartilage and menisci. In the image on the right, you can see the clear difference with a knee affected by very severe osteoarthritis, in which the two bones on the inner side are now completely in contact with each other, and where there is obvious calcification and wear of the joint surface in the lateral compartment, because that compartment, although to a lesser extent than the inner one, is also affected by a degenerative process of the cartilage. The same X-ray of a patient with no specific knee problems still on your left is now compared with that of a patient with osteoarthritis localized only in the inner compartment. In this case, we can see a reduction in the joint space between the femur and tibia only on the inside, as shown by the red arrow, allowing us to appreciate the difference in height compared to the joint space of the external compartment, as indicated by the blue arrow. We must therefore understand that knee osteoarthritis can affect a limited or much larger area of the knee. Depending on the specific case, we have the choice of implanting a partial or total prosthesis. In these two X-ray images, you can easily see the difference between a total prosthesis on your left and a partial prosthesis on your right, which replaces only a very limited portion of the knee, thus explaining why it can be considered a much less invasive procedure with a much shorter recovery period than total knee replacement surgery. Unfortunately, not everyone can hope to undergo this surgery, which cannot be performed when, for example, there is instability of the knee ligaments or significant joint stiffness. As mentioned, the procedure is also not offered when osteoarthritis significantly affects the entire knee, or when the knee itself has a valgus or varus deviation greater than 5 degrees and 10 degrees respectively. It is therefore essential that your surgeon carefully assesses whether partial replacement surgery is appropriate in your case. The operation is generally performed under spinal anesthesia, which is an injection in the back, which has the undeniable advantage of numbing the operated leg for several hours. We recommend this type of anesthesia over the other option, which is general anesthesia. The surgery is performed with the patient lying on their back. The anatomical landmarks, represented by the patella, the tibial tuberosity, and the tendon located between them, are identified, and then a surgical incision is made, the length of which varies from patient to patient. For a faster recovery after surgery, I do not use a tourniquet on the thigh, which is similar to the device used on the arm to measure blood pressure. The tourniquet is used to reduce bleeding in the operating room. From a practical point of view, not using the cuff offers more advantages than disadvantages. In fact, it only takes a few extra minutes to accurately identify and close the bleeding vessels, with the undoubted advantage that the thigh muscles are not compressed by the high-pressure pneumatic tourniquet, which is an additional trauma for the muscles. Once the skin has been cut and the first hemostasis of the blood vessels has been performed, we go deeper, using an instrument that cuts and burns small arteries and veins at the same time. In a few steps, we reach the joint capsule. The joint capsule must be cut so as to follow the inner edge of the patella without going beyond it. To do this, we once again use the electric scalpel, which cuts the tissue and coagulates the vessels, reducing bleeding. After a few more steps, access to the joint is complete, allowing us to position the first guides for cutting the inner part of the tibia, which is done with two different types of motorized blades. The first is vertical, with a cut made alongside the cruciate ligaments, followed by a horizontal blade used to cut the inner part of the tibia. Once the vertical and horizontal cuts have been completed, the inner part of the tibia is easily removed, and we can then move on to perform the same type of procedure, but using different cutting guides at the level of the femur. The great advantage of all these cutting guides is that they provide a space within which the saw blade follows a preset path, allowing extremely precise cuts to be made. As we have already seen for the tibia, after completing the bone cuts, the fragments are removed, leaving a flat and smooth surface, ideal for subsequently accepting the prosthesis. We now come to the point where we use other instruments to prepare the prosthesis bed on the bone. Once this phase is complete, while the surgical technician prepares the sterile cement, the surgeon thoroughly washes the bone surface using a high-pressure washing system that also incorporates suction to remove any bone or soft tissue fragments. It is equally important to clean the bone surface thoroughly because it is the surface that will come into contact with the cemented prosthesis. The cement I mentioned earlier is a type of glue that is prepared under vacuum by mixing a powder that polymerizes after adding a liquid that triggers a reaction, resulting in a paste that is spread on the part of the prosthesis that will come into contact with the bone, thus ensuring immediate stabilization. After inserting the prosthesis with the cement still soft into the housings we have previously prepared, we tap the metal components to ensure perfect adhesion of the prosthesis. The soft cement that comes out due to the pressure we have exerted will be completely removed before it hardens completely over the next few minutes. After waiting for the cement to harden completely, about 12 or 13 minutes, we insert the final part, made of high molecular weight plastic, called polyethylene, between the metal components of the femur, above, and the tibia, below. This plastic component is extremely resistant and has the important function of recreating the height of the joint, preventing the two metal surfaces from touching each other. After checking once again that the knee is perfectly stable and mobile, we begin to close the joint capsule and the skin using absorbable sutures and metal staples, which will be removed only 2 weeks after surgery. The patient can immediately bear weight with the aid of a walker or crutches, which will be discarded within a few weeks. It is necessary to start moving the knee immediately and intensively in order to accelerate functional recovery. After this surgery, it is almost never necessary to go to a rehabilitation center. In fact, after 3 to 5 days at most, the patient is already able to return home, where they will continue their physical therapy with exercises to be done every day and visits to the physical therapist at least twice a week. As we have already mentioned, the metal stitches on the skin will be removed by your surgeon after 2 weeks. The fact that this is an invasive surgical procedure, and especially the use of sharp instruments such as saws, will naturally lead you to believe that the operation is extremely painful. Fortunately, this is not the case, provided that well-standardized local anesthesia protocols are used. I will now show you how the patient, less than 2 hours after surgery, is already able to move his knee well, without difficulty, thanks in part to the fact that no pneumatic tourniquet was used on his thigh. In this other video, the same patient is able to walk 1 day after the operation using only a crutch. Surgery naturally involves risks and complications that must be discussed with your surgeon before the operation. However, this operation has a high satisfaction rate, provided it is offered to the right patients. Thank you for sharing this video and subscribe to our channel.